Hi, this is our sports injuries presentation, assignment 3. I'm Carl Winter, Win 16003628.
Blake Hayes, HAS 17001635.
So to start with, we'll be talking about my client's biography. His name is Ben Andrew Sherborne, 34 years old. His fitness level is above average. He's a fourth choice keeper for Bridgewater College development squad. He stands at 6'1" and he weighs 92 kilograms. So Ben injured his shoulder from diving for a ball and misjudging the momentum and placement of the ball, ultimately crashing into the post due to his power and weight. The sheer force of momentum caused his shoulder to pop out of place, also known as traumatic shoulder dislocation. Due to the insane mobility of the shoulder joint, it means that you are unable to lift your arm and move it in various directions, but this does come to a cost with the stability of the shoulder, meaning it can come out of place quite easily. A shoulder will dislocate when the ball of the humerus is forced out of its normal position of the glenoid labrum. The shoulder joint is a ball and socket joint, which means it can rotate in many directions with ease. However, this does come with a risk. The shoulder joint is located above the humerus and is surrounded by connective tissues and the glenohumeral ligaments, which further reinforce stability in the shoulder joint. When a person uses too much force on the shoulder joint, such as a fall, then it means that the excessive force might be too much and can cause the connective tissues to tear. This then may cause the humerus to move out of the socket. More on the shoulder. Shoulder dislocations usually occur traumatically because of a violent force has shoved it out of place. In Ben's instance, colliding with the football goal post, creating enough force to realign and put out of place his shoulder. Ben suffered from an anterior shoulder dislocation, which means that the ball and the socket came out of place forwards because of the combination of movements which were involved: shoulder abduction and external rotation, which is otherly known as side elevation and outer rotation of the humerus of the upper arm. When Ben's injury occurred, the therapist ran quickly to the scene whilst the match was held for a while so he could be treated. The therapist went through the process of SOLTAPs. This is a series of stages to see what the injury is and needs to be done at the specific time. Ben couldn't move his arm and said there was sudden pain. The therapist also noticed that the shoulder was swelling and bruising. However, normally the recipients would feel a popping sensation, additionally feel the shoulder popping out of place. But because of the focus on what Ben was doing, he didn't. Therefore, the therapist held him up and instantly knew it wasn't a break, as the shoulder was unaligned and out of place compared to the other shoulder. They also knew this because Ben was suffering with pins and needles in his hand, which is a sign of dislocation of a shoulder. Depending on the knowledge of the therapist, they can take action at the scene and relocate the shoulder. However, on this instance, he went to A&E and was slinged up to hold the shoulder in place whilst getting to the hospital to stop any movement of the shoulder. The doctor performed reduction on Ben, which is putting the shoulder back into place, and the pain stopped quite suddenly. The process of Ben being able to perform football again roughly should take 8 to 10 weeks with the correct rehabilitation. Once a specialist has seen the shoulder, and Ben has been sent to the x-ray already, and they can confirm that he has a dislocated shoulder, it means that they will realign the shoulder. The client may be offered some anaesthetics to numb the area so it doesn't hurt as much. However, they must apply enough force to pop the shoulder back into place. After this, Ben will still feel pain in the shoulder due to bruising and swelling. However, he will now be able to gradually move his shoulder again. Also, he may feel weakness in that area. All the symptoms of this will gradually retract during an effective rehabilitation process. There are 4 different stages to the stepladder approach, and this involves rest, stretching, strengthening, and functional. In these stages, there are helpful ways which Ben can recover from his injury and get back to performing as quick as possible. Start off with rest. The first process of the stepladder is rest. This is to ensure that the athlete doesn't injure themselves even more by moving the shoulder. Therefore, certain transactions will be formed to help the shoulder itself. Firstly, the RICE program. The shoulder will be slinged up and will be used for several weeks, 6 weeks, to keep the shoulder stable and to limit movements to make the injury worse. This will be the first process of RICE, as it is protecting the joint from being jarred or moved further. Also, rest is self-explanatory, so he should limit the movements and not perform in any activities until the rehabilitation process has been performed. If done correctly, then the athlete could be given the all clear sooner than the all clear date estimation. Ice should be used on the shoulder to eliminate the swelling after a while. Same goes with the compression and elevation, as it will keep the blood flow away from the injured area, and so the healing process can take place, so the swelling and bruising can deplete and the debris can be removed efficiently. So rest. The activity shouldn't be performed during this time, so the injured area is protected from sudden job movements which can cause the area to become worse and more vulnerable. The ice side of things, this will reduce the pain and swelling. The ice pack should be used to minimise the swelling, and the ice pack should be applied for 10 to 20 minutes at 3 times or more a day to get the best out of it. This should also be performed 3 to 4 times a week. Once the swelling has gone, apply some heat to the sore that still hurts. Furthermore, the ice and heat shouldn't be placed onto contact with the skin, therefore there should be something covering it beforehand, like a towel, so the athlete doesn't have a risk of being burnt by the ice or heat, which could cause more pain and insufficiently aid the injured area. Compression. Wrapping the shoulder with bandaging will help again decrease swelling. The wrapping shouldn't be wrapped too tightly, and that can cause more swelling than before, causing more pain for the athlete. The bandage, therefore, if too tight, should be loosened immediately. Signs of this occurring is the athlete will feel numbness, tingling, or increased pain to the area of injury. The athlete should tell if the bandage is too tight for them. The compression again should be done throughout the day after icing the wound. Finally, elevation. Having the shoulder lifted above the core will allow the body to minimise swelling again. This should be performed when icing the injured site. Next is stretching. Some stretches will be given to help the shoulder become elasticated once more, as it may become very tight after being slinged up for several weeks. However, some stretches to avoid would be the ones which would cause the arm to be held out at 90 degrees and power rotated upwards, as it can cause an unnatural strain of the shoulder. The following exercises used to ease stiffness in the shoulder and pain, which further will aid recovery process, and this will be done once the sling has been removed for the time being. This should be performed for 3 to 4 weeks into the process. The first stretch would be shoulder flexion. This would be performed sat down. This should be performed with the other arm supporting the weakened shoulder via the elbow. Then bend should gently lean forward, and the arm should rock slightly back and forwards as far as the pain will allow. The second stretch is called shoulder abduction. Again, this will be performed sitting down. Support the injured arm against under the elbow, then lean gently forwards but rock the injured arm by side to side this time until as far as the pain allows. The third stretch will consist of shoulder lateral rotation. This will be performed sitting down. This should keep your elbow to the side, and the stronger arm should be supporting the injured shoulder by holding the wrist of that side. Then bend should gently move the hand 90 degrees to the body. Bend shouldn't go further than what the pain allows, as this could injure him even more and return to neutral. Each stretch should be performed throughout the day at least 3 times, and then the stretch itself should be held for 10 seconds before relaxing again to maximise efficiency. The stretching process would be done for at least 2 to 3 weeks during the process. This will then allow him to perform the next stage of the stepladder process far better. And here is the examples of how to perform the stretches. Next is strengthening. When it comes to strengthening, the area of weakness, in this instance Ben's shoulder, he can perform many different exercises, some simpler than others, which will help build up the strength in the shoulder. The movements will be performed once the stretching phase has commenced. These will consist of static strengthening exercises, mobility exercises, and the shoulder strengthening exercises using the TheraBand. The further the list goes, the more difficult and harder the stretches will be performed. Firstly, the static exercise work the muscles of the shoulder without the moving of the actual shoulder. All these exercises should consist of the elbow being bent at 90 degrees and the arm should be sturdy. The exercises would be performed 10 times and be held for 5 to 10 seconds apart, and they should be repeated 3 times a day. They consist of shoulder flexors. This is an attempt to push the wall with your fist. Shoulder extensors is an attempt to press your elbow against the wall. Shoulder abductors, this is where they stand sideways and press against the arm against the wall. And finally, shoulder abductors, which is when a towel is underneath the arm and the athlete will try and squeeze their arm to the side. The mobility stretches help regain mobility in the shoulder. This can be used by obtaining a stick, umbrella or a broom. These again should be done 10 times repeated and 4 times a day. If possible for Ben, hold the stretch for 5 seconds at the end point. The first is shoulder flexion. You lift the stick above your head. and then hold it for 5 seconds. Shoulder abduction, hold the stick with both hands, keeping the elbow straight and bring your arms to the side upwards towards the shoulder. Shoulder extension, hold the stick behind your back and move the stick away from your back, keeping your elbow straight. And shoulder internal rotation, hold the stick behind your back with both hands and as close together as possible, and then lift the stick. Finally, these exercises are to work the muscles around the shoulder with the use of a TheraBand. These should be repeated 20 times each for 3 times a day, and the stretch should be held for 3 to 5 seconds each time. Firstly, external rotators. Standing side on, keeping your elbow to the side, pull the TheraBand outwards and slowly let it back in. Internal rotators, hold the TheraBand with your wounded side, keeping your elbow to the side, and pull the TheraBand across your body and rotate your arm inwards slowly. Shoulder extensors, with the affected arm, pull the TheraBand backwards, keeping your elbow tucked in and bent. And finally, shoulder flexors, back facing the wall, holding the TheraBand and push your hand forwards in a punching motion. Finally, function and mobility. This is where the athlete will regain familiar movements in which he performed before regaining balance and coordination within the sport he plays. Firstly, I'll explain some exercises he can do to perform the mobility side of things. The first exercise will be general, and this will be shoulder flexion. This will be lifting the stick above your head and holding it for a few seconds. Another exercise will be done by a TheraBand, and this is called external rotator. This is where Ben will stand sideways and pull the band across him with his weaker side. Finally, there will be weight-bearing exercises involved, as the shoulder should now be able to support the body weight of the athlete with the correct rehabilitation. So exercises like wall push-ups, knee push-ups, and normal push-ups, gradually to do more and more to build the shoulder up more and more. Getting to the functional side of things, Ben can take part in certain movements he would as a keeper. Ben will take part in certain exercises which will further prepare him for goalkeeping. These exercises can consist of slowly diving to the floor on either side and getting back up again, in they used to when he was performing. This will allow his muscles to get used to the impact of the dive again. Slowly and steadily, this will gradually get quicker and quicker over time. Another movement is Ben can throw the ball in a straight line out to a player and practice that with 50% power. Then after he has done this and got used to it, he can upgrade the power and also change the movements of which the ball can be thrown, such as sidewards or diagonally to the player's outfield or wherever the players are positioned. The player obtains a psychological reassurance because of the fact that he followed the stepladder approach. Therefore, if he missed out on the strengthening part of the process, that means his shoulder will be still quite weak and prone to getting injured. Therefore, it gives him the confidence to perform with the arm because he has followed each individual step of the stepladder approach. Finally, we asked Ben some questions about our program. The first one is, did you understand the injury? He said yes. This is a positive due to the fact that they know how to recover. So it means that when it comes to the future, if they do this again, they don't need the program. They know it already. The second question is, did you find the rehab enjoyable? Ben said no. And the negative is that this could be a boring process. This means that Ben could easily be distracted by doing something else rather than taking part in the program, meaning that his shoulder wouldn't recover as well. Did you feel comfortable in the process? Ben said yes. This is a positive because it means that he would take part in the rehab well, as he feels comfortable doing most of the movements. Did you meet the time of recovery or sooner? Yes. This is a positive because they could get back to performing there much sooner and help the team win some more things, more matches and trophies and things like that. Did this benefit you psychologically? Yes. This means that it gave Ben the never give up attitude. This means that even though he was injured, all this recovery and slow process, building it back up, it means that he can perform again to an ability where he was at before or even better. Did this enable you to perform confidently again? Yes, this allows him to physically get better and better as he is confident in what he's doing and training his shoulder to become stronger and stronger each time. Did the session increase your knowledge of the injury? No, this may still perform movements which will injure him, so it means that in the future he could do the same movement again which injured him in the first place, so this could be bad. So we need to make sure that we adapt our session to make sure he knows what movements are bad for the shoulder. And finally, are you going to carry out with this program? He said yes, and this will allow the bone to get the shoulder stronger and stronger each time, which means that he can perform movements better and more confidently. The things I would change about the session is that I would make the exercises more entertaining for the client. This will allow them to put full effort into the program more often and most likely allow them to perform the program after it is done. And finally, make the session generally more understandable overall. Explain key terms and terminology which the client would understand, and this would allow the client to avoid any movements and certain risks which could affect them.